Hello, 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 everybody. Welcome, welcome, welcome. Tonight, we're going to talk about a new scientific development in the kidney space: kidney transplants without the use of immunosuppressant medications. Why do we use immunosuppressant drugs after our kidney transplants currently? What exactly do they do for us? Immunosuppressant drugs are necessary after a kidney transplant to prevent the recipient's immune system from attacking and destroying the new kidney, a process known as organ rejection. The immune system naturally identifies the transplanted kidney as a foreign object, so these medications suppress the natural defense response to allow the body to accept the organ and keep it working properly for as long as possible. How do they work? Preventing rejection. Immunosuppressants lower the activity of the immune cells that would otherwise target and damage the new kidney. Balancing immunity. These drugs are careful to manage and suppress the immune system just enough to prevent rejection, but also to keep it strong enough to fight off other infections and diseases. What types of medications are we talking about? First, there's introduction therapy, stronger, more powerful medications given just before or right after the transplant to provide immediate protection when the risk of rejection is at its highest. Maintenance therapy, less powerful drugs that are taken daily for the lifetime of the new kidney to provide long-term support and prevent rejection. Rejection treatment, medications used to stop or reverse the rejection process if it begins to occur. Lifelong need and the importance of lifelong use. Stopping or missing these medications, even for a short period of time, can lead to rejection either immediately or over time. The consequences of stopping historically, when recipients stop taking these drugs, it often results in the loss of the transplanted kidney. So, what are the current problems with taking immunosuppressant medications? Well, first, there is the lifelong commitment. Patients must take these medications for life to prevent rejection. Dosing is critical. Missing a dose can increase the risk of immune system rejecting a kidney. Side effects. Long-term use can have side effects such as an increased risk of infection, cancer, and metabolic issues like diabetes or high blood pressure. Multiple medications. Transplant recipients typically take a combination of drugs, including some to prevent infection, which are often stopped after the first 3 to 12 months. The monitoring is necessary. The necessity of monitoring. There you go, Jim. The level of immunosuppressions can be adjusted over time to reduce the side effects while still preventing medication. Or preventing rejection, I'm sorry. So kidney transplants without immunosuppressant medications. A kidney transplant without immunosuppressant medications is possible through the advanced protocols that use a donor's stem cells to create immune tolerance. This process, often called tolerance induction, involves transplanting both the kidney and the stem cells from the same donor, creating a dual immune system where the recipient's body accepts the new kidney as its own. While still experimental, and I want to stress this, while still experimental, these protocols aim to eliminate the lifelong burden of anti-rejection drugs and their associated side effects, and are being explored in clinical trials. How does it work? Simultaneously or sequential transplant. The procedure involves transplanting a kidney and stem cells from the same donor. The stem cells can be infused at the same time as the kidney transplant or separately. Immune tolerance. The donor stem cells are used to generate new immune cells in the recipient's body. This creates a mixed or dual immune system that recognizes both the recipient's own body and the donated organ as self, eliminating the need for immunosuppressant. The goal is to achieve immune intolerance, which would allow the recipient to stop taking immunosuppressant drugs for life or for the life of the kidney and avoid the risks associated with them, such as infection and cancer. Current status and future potential. First, they are in clinical trials. This approach is currently being studied in clinical trials at several major medical centers. Different criteria. Initially, these protocols were developed for closely matched living donors, such as siblings. However, ongoing studies like the Freedom 1 study are expanding to include donor-recipient pairs with less than perfectly matched immune systems. Potential benefits. If successful, this could dramatically improve the quality of life for transplant recipients by freeing them from the side effects of a lifetime of medication. Important considerations. Not yet the standard of care. I want to stress that again. These are experimental. Not yet the standard of care. While promising, this is not yet the standard procedure. For all kidney transplants. This requires specialized teams. Performing this type of transplant requires an experienced team with both expertise in kidney and bone marrow and stem cell transplantation. What is tolerance induction? Kidney transplant tolerance induction aims to achieve immune acceptance of the new kidney without the need for long-term immunosuppressant drugs by establishing mixed chimerism, CHIMERISM, where the recipient's body accepts donor stem cells. This is most often accomplished by combining the kidney transplant with a transplant of donor hematopoietic stem cell, hematopoietic stem cells, which are blood marrows or blood stem cells from the same donor. The process involves conditioning the recipient before the transplants to prepare their immune system for donor cells. So what is this process of tolerance induction? Combined transplant. The kidney is transplanted at the same time or in a sequence with a transplant of hemopoietic stem cells, bone marrow or blood stem cells from the living kidney donor. Recipient conditioning. Before the transplants, the recipient undergoes a regimen of conditioning treatments, such as irradiation and other medications to prepare their immune system to accept donor cells. Mixed chimerism. Donor cells are infused, and once they engraft in a recipient, they create a state of mixed chimerism, where the recipient's blood and immune system contain a mix of both donor and recipient cells. Immune acceptance. This mixed chimerism helps the recipient's immune system to recognize the donor as self, leading to tolerance and potentially allowing for a reduction or elimination in immunosuppressant drugs over time. Goals and benefits. First, to eliminate immunosuppression. The ultimate goal is to achieve an immunosuppressant-free protocol to avoid the long-term side effects and toxicity associated with chronic use of these drugs. Reducing side effects. By minimizing or eliminating immunosuppressants, patients can avoid issues like an increased risk of infection, kidney damage from the drugs themselves, or other complications. Improving long-term outcomes. Achieving immune tolerance is expected to improve long-term survival of the transplanted kidney. What challenges exist? A risk of graft versus host disease, abbreviated as capital GVHD. A major challenge is to prevent the transplanted donor cells from attacking the recipient's body, which is known as GVHD. The need for specific donor matches. This process often requires specific types of donor-recipient matches and has been more successful in certain types of living donor transplants. Complexity. How complex is this? The combined transplant and conditioning regimen is more complex than a standard kidney transplant. So, what are the other potential methods of achieving the same goal, a kidney transplant without immunosuppressant drugs? Methods for kidney transplant without immunosuppressant drugs rely on creating an immune tolerance by combining the donor and the recipient's immune system, often through transplanting both the kidney and the donor's stem cell. This process, sometimes called a dual immune /solid organ transplant, or a capital DISOT, that's the alternative, is still largely experimental and being tested in clinical trials, especially for patients with closely matched living donors like siblings. The goal is to create a hybrid immune system where the recipient's body accepts the new kidney as its own, eliminating the need for a lifetime of anti-rejection drugs. Key elements of the immunosuppressant-free transplant method. Simultaneous or combined transplant. The method involves transplanting both the kidney and the donor's stem cell or bone marrow at the same time. Immunosystem fusion. The combined transplant is intended to merge with the recipient's and the donor's immune cells, creating a hybrid immune system that recognizes both as self. Targeted approach. This approach is most successful when there is a high degree of tissue matching, such as between siblings who are human leukocyte antigen or HLA identical. Clinical trials. This is an emerging and experimental field with clinical trials underway at institutions like UCLA Health, Stanford Healthcare, Ohio State Health, and Discovery. Potential benefits: elimination of anti-rejection medication. The ultimate goal is to remove the need for lifelong and sometimes difficult regimen of immunosuppressant drugs. To reduce side effects, avoiding immunosuppressants could eliminate their associated side effects, such as metabolic issues, high blood pressure, and a higher risk of infection. It also would promote an improved quality of life. Patients who don't need immunosuppressants could experience a higher quality of life with fewer health complications. Current limitations: experimental stage. These methods are still largely experimental and not widely available. Strict eligibility comes from clinical trials. These trials often require very specific criteria, such as a highly matched living donor like a sibling. Complexity: the procedure is more complex than your standard transplant and requires the donor to undergo additional procedures. So, in conclusion, the experimental drug free kidney transplants, the experiment with drug-free kidney transplants, is a welcome change, and we wish them every success in making this the mainstream treatment of the future. So that's our broadcast for this evening. And we'll get a couple more banners going. And we thank you so much for watching. We're back next week with my friend Jeffrey. He's a kidney transplant patient and a kidney advocate. So it should be an interesting broadcast. And until then, everybody stay safe, and I will talk to you later.